As you prepare an IV medication, use aseptic technique and keep in mind the 6 rights of medication administration. Right medication, right dose, right patient, right route, right time, and right documentation. For a quick review, see the video skill Ensuring the 6 Rights of Medication Administration. Check a drug reference manual to determine how quickly the medication can be given and to ensure that it's compatible with the primary IV solution. Pause twice during your preparation to compare the label carefully with the Medication Administration Record, or MAR. Administer the medication at the time ordered. This is especially important for stat and now doses. After performing hand hygiene and providing privacy, introduce yourself to the patient. Identify him using 2 identifiers.
Full name, please.
Craig Stillman.
Stillman. And your birthday?
April 16th, 1949.
Perform your 3rd check of the label of the IV bolus medication at the bedside. Don't forget to check the expiration date. Ask the patient if he has any known allergies.
Do you have any allergies?
No.
Discuss the drug's purpose and action, and explain that you'll be administering it through his existing IV line. Give him a chance to ask questions and encourage him to report any discomfort at the IV site. Then assess the IV site for signs of phlebitis or infiltration, such as redness, swelling, or discomfort. Perform hand hygiene and apply clean gloves. To deliver an IV bolus through an existing IV line, first confirm the bolus is compatible with the IV fluid. Then select the needleless injection port nearest the patient. Clean the port with an alcohol swab and let it dry. Connect the syringe to the IV tubing by inserting the needleless tip of the medication syringe through the center of the port. Occlude the IV line by pinching the tubing just above the injection port. If a pump is in use, pause it to prevent the alarm from sounding. Then pull back gently on the plunger of the syringe to aspirate for blood return. If the IV is patent, release the tubing and inject the medication over the period of time recommended by agency policy, the pharmacist, or a drug manual. Use your watch to time the administration. After injecting the medication, withdraw the syringe and recheck the IV infusion rate, adjusted as needed. Cloudiness in the IV tubing may indicate that the medication is incompatible with the IV solution and a precipitate is forming. Stop the infusion immediately and change the IV tubing. With the new tubing in place, pinch the IV line and flush it with 10 milliliters of normal saline. Then give the IV bolus over the recommended period of time. Remove the empty syringe and re-clean the port with an alcohol swab. Allow it to dry. Attach a syringe containing 10 milliliters of normal saline and flush at the same rate at which the medication was given. Release the tubing and restart the primary infusion. If the IV line is infusing a medication, disconnect the medication and begin the process of administering the IV bolus if your agency policy allows it. If agency policy prohibits stopping IV fluids or continuous IV medications, start a new IV site and use the IV saline lock method. To deliver an IV bolus through an intermittent IV device, such as a saline lock, verify the patient and medication as shown earlier. Then clean the lock's injection port with an alcohol swab and release the clamp. Next, attach to the injection port a syringe of normal saline. Pull back gently on the plunger of the syringe and check for blood return. Slowly depress the plunger to flush the site with 2 to 3 milliliters of normal saline. As you proceed, be alert for signs of infiltration. Remove the empty syringe and clean the lock's injection port again with a new antiseptic swab. Insert the medication syringe into the injection port and inject the medication within the recommended time frame. After administering the medication, withdraw the syringe and clean the injection port with a new antiseptic swab again. Allow it to dry. Then insert into the injection port a second pre-filled syringe containing normal saline. Flush with 2 to 3 milliliters of normal saline at the rate at which the medication was delivered. Watch the IV site for sudden swelling. As you complete the injection of saline, reclamp the saline lock while maintaining pressure on the syringe plunger. Stay with the patient for several minutes and observe for any adverse or allergic reaction. With either technique, dispose of sharps and syringes in a puncture-proof, leak-proof container. Remove your gloves and perform hand hygiene. As part of your follow-up care, continue to monitor the patient for adverse reactions.